Lakith, as the managing director of the Hemas Hospital Group, what are the plans for the future for healthcare in Sri Lanka, Lakith?
Well, Doctor, we have lots of plans for Hemas Hospitals and also to make sure that it benefits the people of Sri Lanka. So currently we have two hospitals, one in Thalawathukoda and one in Wattala, and then we have a very large network of laboratories. We are just about to expand our Thalawathukoda hospital. It will be a brand new hospital, with the latest technology.
What will be investment like for the expansion?
So it's going to be over a 10 billion investment.
Right.
And so we really want to give something unique to the clinicians as well as to the people of Sri Lanka.
Right. What are the areas that you're going to touch in the new setup?
Yeah. So lots of high-end specialities, starting from robotic surgery to AI-assisted cardiac care, and so we'll be focusing on neuro, ortho, and many areas that there are gaps as of now in Sri Lanka,
Right.
where some of the patients or some of the people would prefer to go overseas for treatment.
Right.
And now we'll be able to, get all that done at Hemas Hospitals.
I hope, Lakith, when the expansion comes on, I think we can expect the foreign patients to come to Sri Lanka and get treatment, no?
Of course, we have the best doctors.
Absolutely.
Compared to any country, our doctors are extremely good, they're extremely well qualified, their postgraduate studies are at a very high level, and backed by, hospitals like ours where we focus a lot on processors, people and technology, will definitely attract people to this market, and Sri Lanka is definitely can become the next hub for medical tourism in this region.
But on the other hand, now there are a lot of Sri Lankans who are living abroad. There are about, I think, 1.5 million people living abroad, more than that, living abroad in other countries such as UK, US, Australia, and other parts of the world. Now, their medical needs should be also catered by us, I think, in time to come.
Yeah, definitely, because access to healthcare in many of these countries are quite difficult. Right, in order for you to go through that system, and the time comes to see a specialist, right? It's a very long time, and all Sri Lankans living overseas to come and do their treatment in Sri Lanka is a very, very good option, and also at a fraction of the cost.
Yeah, absolutely. Because and the other thing that a lot of foreign people who have lived in the foreign countries, they expect a lot of different level of service, and not only from the doctors, but the support services as well. How are you geared in that training of those support services for the patient care?
Yeah. So one thing is that let me talk about Hemas, and Hemas is an internationally accredited hospital. In fact, we were the first hospital in this country to be internationally accredited.
Right.
All our hospitals have different multiple accreditation. So if you look at our standard of care is as good as any accredited hospital in the world. But Hemas especially gives a lot of focus on patient experience. There are lots of things that we do to make sure that patients are satisfied with the service levels. We track NPS, Net Promoter Score, every day.
Oh, right.
At all our institutions, and that's one way that you can really look at the service standards. And also, if you look at the Google ranking, we are the highest Google ranked hospital in this country.
Oh, that's great.
So Hemas Wattala is at 4.8 and Hemas Thalawathukoda is at 4.6. So 1 and 2 are both Hemas.
Excellent. That's because when the public comments, public views matters a lot.
Yes.
Whenever we go to a hotel to eat, now we look at the reviews.
Very
and
true.
Therefore, it's the same way how the patient perceives your care. I think congratulations for that.
Thank you.
Yeah, because basically that's very hard to achieve. When they're physically down, mentally down, when they come to institution, they expect sun, moon, and little bit of stars sometimes.
Yeah.
But still, for them to be satisfied and getting out of your doors is a good thing. Now, as far as the Medicare is concerned, now since you have been a leader in the healthcare industry, how do you think that the Medicare can serve better for the people, as an exhibition? platform.
So I think first I must congratulate
Thank you.
you and the team for having Medicare and having it without an interruption. I know how difficult it is to put up such an exhibition, and it's an international exhibition. So I think it's really good. It serves the healthcare industry as well as the people of Sri Lanka for them to get exposed to what is available in this country. And I think you're doing a great job.
Thank you. Thank you.
And I hope that you will continue to
No, with your support, with the industry support,
make Medicare grow from strength to strength. And we will be behind you.
Thank you so much. Thank you. Because I think the industry leads are extremely important. Because you as whenever you are very busy people in the sector, and for you to get your team into the exhibition and then showcase what you do, and then get the public feelings of what you in a non-clinical setting. In a hospital they will not come. We talk about what they want and needs and all that. But outside setting, it's always nice to see what public feels about you in non-clinical setting.